All right, I think we're going to start. We have 7 participants at the moment, but I think we should just start. Okay, good morning, good afternoon, good evening from wherever you can hear me from. My name is Oluwatoyin Akinlade, and I welcome you to today's webinar program. Thank you to our presenter today. Thank you for honoring the invite, and thank you to everyone for joining, leaving all your busy schedules to join today's webinar. I'm sure we're going to enjoy ourselves as we go along. I would make a plea that we hold on like 2 minutes more before we start to see if more people are going to join. We have 9 participants at the moment, so that we can have enough people to join this webinar before we start. I don't know if that is okay by you, Debusala.
Yeah, that's fine. Thank you.
Yeah. All right, we'll hold on a minute and then over to you, Idris Olalika, for introduction of our guest. Thank you.
Good morning, good afternoon, good evening, everyone. My name is Idris Olalika. So I will proceed to introduce our guest lecturer for today. We are delighted to announce Pyn Lim, CEO and founder of European College of Aesthetic Medicine and Surgery, as a distinguished speaker for this webinar on transitioning into medical aesthetics, a roadmap for medical professionals. Pyn Lim brings a weight of experience and expertise to the table. She is a distinguished leader in the field of aesthetic medicine and surgery, renowned for her role as CEO and founder of European College of Aesthetic Medicine and Surgery, and history. With a career span of over 25 years, she has made significant contributions to the aesthetic medicine industry, particularly in the areas of education, business operation, and pharmaceutical practices. Her work emphasizes the importance of education and training in aesthetic medicine, and she has been instrumental in developing comprehensive training programs in collaboration with various institutions and professionals globally. Under her leadership, she has become prominent educational institution, offering a range of programs from cadaver dissections to master-level training in aesthetic medicine and surgery. She has also successfully led Venus Medical, building it into a thriving multi-million aesthetic medicine practice. His commitment to rising standard in aesthetic practice is evidenced by our advocacy for digital literacy and our effort to empower practitioners with the skills and knowledge needed to excel in constantly evolving aesthetic industry. Recognized for her exceptional performance and dedications, she has been honored with prestigious Business All-Star accreditations, highlighting her truthfulness, commitment, and customer-centric approach in the field. Our visionary leadership continues to shape the landscape of aesthetic medicine and surgery, making a significant contribution to the industry development and standard globally. Please join me in welcoming Pyn Lim to this invaluable insights into with us. Thank you so much.
Thank you so much for the introduction, and thank you so much for everyone. I think we have altogether 13 participants. My name is Pyn Lim, and I would like to thank you so much for actually taking the time off. Today is Sunday, and come and listen to this talk. And I will try to give you as much information as possible. just so that we can actually give you a great idea if you guys are actually going to be interested in an aesthetics world. Now, before I begin, I just wanted to know more about my audience. Is any one of you, where are you guys from? Are you from, which country are you from? And are you already in the aesthetic industry or you are not? If you can actually do that on the chat box, that would be great, just so that then I can have a little bit of a background, and I will try to gear my talks towards the specific country. Okay. And also, so we have USA. I think there is also people from South Africa, South America, and Rwanda. And the position that you guys are in, Pakistan surgical resident, okay. Are you guys mostly medical doctors or anesthesiologists or nurse? Okay, so feel free type away, because I'll be looking at your chat. And so let me firstly introduce to you a little bit about myself. Can you guys see my screen?
Yes.
Yes, okay, good. So am I blocking any of the view? Am I blocking the wording? I think I am. So let me just change okay, so that I will blank myself. In this way, you don't see me. Okay, all right, cool. So I have in total 34 years in business.
I think we can see you, Pyn. We can see you. It's blocked now.
Oh, now you can't see?
Yes, we can't actually see what's written on the presentation.
Okay, all right. So let me just do that again one more time. Now, can you see now? Can you see?
Yes,
No.
ma'am.
Okay.
Yes, well, we can see.
You can see, right? Okay, all right,
Yeah.
cool. Okay, good. Thank you so much. So in total, I have 34 years in business development, and for 17 years of my first part of my life, I have been doing IT consulting. So I'm a consultant in all the different various sectors, such as a pharmaceutical industry, education industry, semiconductor, and automobile industry. And then since 2006, which is the second part of my life, I have been in the aesthetic industry. And in 2008, I saw the lack of proper training in this industry, which is at the same time up to date. It is also highly unregulated. So together with a few experts, surgeons and doctors, we formed European College of Aesthetic Medicine and Surgery. So why am I so passionate about aesthetics and helping ECAMS certified doctors to succeed? Is because I came from a patient perspective. And from a patient perspective, and years after years, I see the lack of knowledge of medical professionals, understanding and having the business acumen to run their practice properly and ethically. And of course, at the same time, we're talking about the aesthetic skill sets, developing the aesthetic skill sets due to the lack of proper training organizations. So in order to raise the aesthetic standards in this industry and to make an impact in this world, I decided my mission is to create a safer and more beautiful world for patients, and at the same time to help medical professionals to build their business acumen so that they can adhere to good ethics and truly help their patients. I think a lot of times when you talk to doctors that are, or surgeons that are actually not from this part of the aesthetic specialties, very often they kind of underestimate how much there is it is actually very much an evidence-based and scientific-based procedures. So of course, due to the lack of regulation, so therefore a lot of the country, which I'm going to go into that is unregulated, and a lot of people, even without being a medical professional, they are able to provide aesthetics procedures. So, so this is a little bit background of myself, and I'm originally from Singapore, but I come from, I'm right now based in Ireland, and European College of Aesthetic Medicine is also based in Ireland. So today what I'm going to do is I'm going to give you a little bit of an introduction, and then what is aesthetics, medical aesthetics, and I'm going to let you understand what is the differences. Then I'm going to touch base about the regulation, the legality, and also the ethical considerations. Then I will talk about how to get yourself skills and qualified and certified. Then I will touch base a little bit about how to integrate your aesthetics into your current practice. Again, I'm not sure currently what is my audience. So I assume that all of you don't have your practice, or it could have, or you already have a private practice or a clinic, but not doing aesthetics at this moment. So again, then I will talk about what is the financial and the business aspect, then touch base a little bit of the marketing. Now, I will try to go as high level as possible, because each of these topics I can actually really drill down in details, and it's going to take us forever. So I'm not going to do that. Now, let's start off with the introduction. So what is aesthetics industry? So at this moment, if you look at the aesthetics, that is in 2023, the market share of aesthetics is actually 127.1 billion in total. So I'm talking about medical aesthetics. And they are forecasting that with the compound annual growth rates of 14.9%, by 2030, it will grow to 332.1 billion. So again, this market shares we are talking about is only on the medical aesthetics industry. I haven't even touched about the medical wellness. Medical wellness, again, is another big market share, because the medical wellness, we are more talking about a different type of a treatment. Okay, that we'll talk about that later on. Next time when we have a chance, maybe we can organize another part to talk about medical wellness. So medical wellness projected 2030 is going to be around, I think, 14.1 trillion. Okay, so it is a lot of market revenue over there, and enough for a lot of people to share this growing markets. And mostly, if you look at the current market shares based on the 127.1 billion, majority come from the surgical part, and then there is a small sector, not the small sector, actually is quite a great sector of it is come from the non-surgical part. So non-surgical, we are talking about the energy device, we're talking about Botox, fillers, biocollagen injectables. So all these, anything that is non-surgical, because the price is lower, so obviously then when you talk about the surgical part, it tends to have a bigger market shares. But if you're talking about the numbers, non-surgical, the number of procedures that is actually performed for non-surgical is higher than the surgical. All right. Now, if you guys have any questions, feel free to stop me, and I'll put it on the chat box just so that then I can answer it there then. So what is non-surgical? What is the words aesthetic medicines, and what is aesthetic surgery, and what is plastic surgery? Now, all these terms is very often used, and it is very, very confusing for a lot of patients, because to them, aesthetics procedures, it means plastic surgery, you know, so there is a lot of terminology, and of course between the specialties there's also a lot of tension between them, fighting who's supposed to do what. So but very clear, I think in every country's aesthetic procedures is an elective procedures, meaning insurance you can't claim, and the plastic surgery is a medical functional procedures, which means people they are doing more on a reconstructive work, dealing with congenital defects, disabilities, injury repairs, and a lot of time is actually towards medical reasons. So, but I will talk about, before I move to this part, I'll talk about a lot of the insurance and some of the, in some country, a lot of medical professional is actually misusing the plastic surgery so that their patient can be covered under insurance. So, so again, we'll talk about that later on. So aesthetics medicines is the procedures range from non-surgical and minimally invasive. So all these are classified under aesthetic medicine. And when we talk about aesthetic surgery, we are talking about all the surgical procedures, like for example, facelift, neck lift, fat transfer, lip lift, brow lift, autoplasty, hair transplantation, liposuction, tummy tuck, genital rejuvenation, breast augmentation, breast lift, bunion surgery. All these are under surgical. So these are called aesthetic surgery procedures. And when someone is talking about aesthetic medicines, we're talking about Botox, fillers, different types of fillers, biocollagen stimulator, chemical pills, energy device treatment, microneedling, PRP, thread lift, laser skin resurfacing. And what is PRP is plasma-rich platelets. Basically, you draw the blood and then you extract out the PRP, the plasma-rich platelet, because there is a lot of growth factor, and then you inject back into their skin for rejuvenation. And then there is also orthopedic surgeon that is actually using that to treat some of the bone issue. So so that there is a lot of a cross path if you look at it between different specialties, whether is this a dermatologist, or is this a GP, or is this an aesthetic doctors, or if this should we be classified under ophthalmologists, because since they deal everything with eyes, and could this be also maxillofacial surgeon? So you can see that, and of course gynecology, because of there's a lot of non-surgical genital rejuvenation procedures under aesthetic medicines. So, and also under aesthetic surgery. So there is a lot of a cross specialty, and everybody is fighting for this piece of cake. So, and that's the reason why there is so many regulation. That is because of also it is highly unregulated. So therefore, a lot of a society is being formed just to fight over who can do what and who do what and who is safer to do what. So another things about the energy device treatment, a lot of times we're talking about like energy device like Faibf, which is kind of a high intensity frequency electromagnetic stimulation procedures. There's a lot of aesthetics devices that is actually right now built up to help to actually lift the face or lift the skin or lift the neck non-surgically. So this is this is the elective procedures, which means people has to come out with their own pocket money in order to be able to have these procedures. Now, for plastic surgery, it's mostly for reconstruction work. So when we talk about, say, for example, if a plastic surgeon, if they want to get into the aesthetic surgery, they have to take an additional skill sets in order to learn. So be it whatever specialty that you're coming from, everybody has to put in an additional effort to actually get themselves trained in the aesthetics procedures industry if they want to get into aesthetics. So the training is very crucial. All right. So the next slides that I wanted to talk about is the relevance to the medical professional. So as a medical professionals, your primary goal has always been improve the health and well-being of your patients, right? So aesthetic medicines and aesthetic surgery extends this goal to include not just health, but also psychological health and also emotional well-being. It's about helping the patient to feel more confident and comfortable in their skin, which is a crucial aspect of a holistic healthcare approach. And this is also one of the reasons why a lot of the times people that are doing reconstructive work right now, they have to take into consideration the aesthetics part of it. So that's the reason why it also have been on the rise to make sure that the healthcare professionals is actually giving a holistic approach to the patient, for the patients. So of course, for those of you that is actually in the operating theater, the skills that you possess, which is precision and eye for details, and also a focus on patient safety, these are all directly transferable and highly valuable in the field of medical aesthetics. All right, so this field offers you a unique opportunity to blend your clinical expertise with an artistic touch. So the artistic touch is very, very important. If you look at my previous slides, as I said, aesthetics is about blending in the arts and the science aspect of it, whereas the plastic surgery is only about the science, the reconstruction work. But now, in a lot of the country like US and a lot of the more developed country, they are slowly understanding the needs of aesthetics and the importance of aesthetics medical. So that's why they are starting to provide aesthetics as part of their last leg of their surgical training or their specialty training, all right, for the plastic surgery doctors. So now the regulations and the legality and ethical considerations, what you need to do. So if you look at the regulation, basically, I can be since 2006, and now 17 years later, the regulations are still very, very loose. Basically, sometimes I can say that there is no regulation, which is the scariest part. And I can understand, I mean, because based on the history, as I said, you know, this aesthetics is cross path between all the different specialties. So therefore, it is very difficult to regulate because it's cross path to so many different specialties. So, and everybody wanted to have a pie of it. So that's why until right now, there is either loose or highly unregulated. But if I want to touch on who can practice aesthetic medicines and aesthetic surgery, it's all depends on the geographical where we are, which country I'm coming from. So before you want to get into any aesthetics, you need to make sure that you check your country regulation first. If there's any, usually they will put it up on the medical council website. And if there is none, then that means most likely there is no regulation at all. So in general, most of the time for aesthetics procedures and aesthetics surgery, it is supposed to be done by either the medical doctors, surgeons, or in some country, dentists. And in some country like UK, Ireland, USA, Australia, New Zealand, registered nurse, and I think in some states, medical assistants and physician assistants are able to perform the aesthetic medicine procedure, not the surgery, but the aesthetic medicine procedures. And in some countries, aesthetician, I think in India, aestheticians are able to perform. When I say aestheticians, I think they are usually the beauticians. So, or maybe someone that has been in the industry, not necessarily they have to have a certain qualifications. So they will be able to perform the aesthetic medicine procedure. So as you can see, this is really very loosely controlled. And if I don't have a slide on the importance of the aesthetic medicine procedure, because it is not just about injectables. It is more than injectables. You can lead to serious complication if you are not trained and if it's performed by unqualified practitioner. So training is essential. So be it whether whichever place that you come from, you need to get yourself trained properly in order for you to be able to perform such procedures and to get into aesthetics industry. So like ECAMS, our training organization is actually one of the only institute in the world that actually provide a end-to-end training. And at this moment, we only train medical doctors, medical surgeon, and also dentists, depending on provided if the country allow them to inject. So we don't train nurse because there's a lot of controversial around these topics and it's highly sensitive. So therefore, ECAMS, right from the beginning, we have made the decision that we want to make sure we provide our training only for the medical doctors and surgeons, just so that we can have a level that is easier for us to actually, when we go deep into the science and the medical aspects. And I will give you also my thoughts about why we felt that nurse and also medical physicians shouldn't be doing injectables, especially for fillers aspects, and I'll tell you why. So under here, if you look at the training, what are the different types of training? So you can either go to institutions like ECAMS, or you can find a doctors that are willing to train you. And there is a lot of doctors that is actually because they wanted to earn side income. So they train, they will offer training to other practitioners. And of course, a lot of the product company are also offering training for medical professional. And also you have also pop-up training, which is sometimes it is a practice, is a training school that is actually owned by either a nurse or a medical practitioner, that they will do half of it is injectables, or half of their time they dealt with patients, and the other half of the time they dealt with a training. So these are, I term it as pop-up training. So depending on their country, I know some country doesn't need malpractice insurance, but it is with the training certificate that you achieved, then the malpractice insurance will cover you and will cover you for all these procedures. Like for example, in Ireland, without doctors coming or nurse coming to a proper an unbiased training institute, they will not insure the practitioner. So when I say unbiased institute, meaning that it's not the product training, because product training obviously is biased. And also it shouldn't be a part-time trainer that is doing the training, because they need to conform to a certain standards in order to be offering training and not just shadowing. And also the pop-up training is also sometimes it depends on them, whether do they have a CME regulated, do they have a head of department scientific committee that is actually looking at the programs and ongoing upgrading the programs. So with that, then the malpractice insurance company will then insure whoever that wanted to get into aesthetic industry. Then with that malpractice insurance, that's when you then able to open up your clinic. You can start off as a freelancer. That means you work in other clinics based on commission base, or you can work full-time as aesthetic doctors or aesthetic surgeons in another clinic. That means someone hired you as a full-time employee, or you can set up your own practice. All right, so these are all the different types of a possibility that you can get yourself into the aesthetic industry. So if you are a nurse, a lot of the nurses, what they do is that they get themselves trained, then they work in a clinic as a aesthetician, medical aesthetician. So now the legal and ethical considerations. So the legal aspects is that, as I said, a lot of times, because this is a elective procedures, so therefore, of course, you are being exposed to a lot of lawsuit cases, especially in the US, in the UK is coming up, and also in Ireland. So, therefore, you need to be very, if you are setting up a aesthetic practice, you need to make sure, you need to discuss with your find out about the laws and regulations in whichever country that you are actually practicing in, so that you are able to understand, to get yourself prepared, especially on the consent form, and what are the terminology you need to put in the consent form, what are the things you need to put in the consent form. For example, every consent form you should put in that you have to take the before and after picture. It is a must, and it is not an optional things for a patient. And this you have to word in, and you need to make sure you get yourself, if your country is actually very sensitive about the GDPR, then you need to make sure that you are actually have a system, be it a hard documents or a soft copy, make sure that system is compliant to the GDPR. So you need to have all the records, consent form, everything to be properly documented. So on the ethical consideration, of course, you have to, the emphasis on prioritizing patients' safety and well-being is number one. And of course, confidentiality. And when I say confidentiality is also, for example, in Ireland, let me give an example. Irish people, so it depends on your market, they are still very shy about letting people know that they have aesthetics procedures. So therefore, when I set up a clinic in aesthetic in Dublin, I literally need to find a premises that hopefully I can have a one entrance and one exit, so that people doesn't cross path, in case, especially if I have a surgical theater in the clinic, then it is also important that I don't want my healthy patient or my potential patient to be seeing wrap up, just finish the surgical procedures, to be going out on the same exit. So all these you need to take into consideration, how sensitive your market is, so that you know how to actually design your clinics. And of course, professional conduct, you need to uphold high ethical standards in your practice, because once you become an aesthetic provider, there will be a lot of women. All you see is women. So therefore, you need to make sure that you uphold to high ethical. And if, you know, there is actually right now in the industry where aesthetic doctors ended up their wife or their girlfriend is actually who used to be their patient. So you need to handle that properly in case if you have an exit. Because when you exit, that's when nastiness comes in. Then you need to understand how to protect your turf. Okay, so these are all the part of the juicy business that actually happening in the beauty industry. Now, the next one is the informed consent. Make sure you explain your procedures very detailed and make sure they understand the associate risk and what is it to your patients, very detailed, just so that you can set their expectation right. Ensure that the patients actually do their decision voluntarily, which means, like, for example, in Ireland, we after the consultation, you need to have a 2 weeks cool off period before they can actually have their procedure done. So if let's say, for example, very often this is ideal, right? But then in real situation, most of the time, patient comes in and they want to have the procedures tomorrow. So having that kind of legal expectations in case if there's anything goes wrong, you need to protect yourself. So therefore, your consent form, part of it, if you don't have the grace period of the 2 weeks for your patient, then you need to make sure that they consent and they sign and they understood that they actually are the one that wanted the procedures as soon as possible. Documentation is crucial, so you make sure that they sign their consent form. You take the before and after picture, because without that, patients very often come back and challenge you and say that I don't see any results. So these are all the things that you need to consider. And advertising regulations. So again, it depends on country by country. I know that in the US, in UK, you can't use the word Botox, but you can still advertise. Like in Turkey, in Turkey itself, in the country, they are not allowed to actually have a before. I don't think it's before and after picture, but I don't think they cannot show any procedures that is in the operating theater. So you need to find out what is your local authority, what you can advertise, what you cannot advertise, because as you right now look at Instagram, it has everything, but because it has all the different countries and different country has different regulation. Like, for example, in Japan, you are not allowed to be actually advertising aesthetic procedures at all, and same for Hong Kong. Malaysia, I think there is certain words and certain regulation you need to adhere to. So no false advertising, realistic expectations. You need to discuss how to manage your patient desire, prioritize their safety, and also set their expectation right, because a lot of times patient comes in and say that I want to look like Jennifer Aniston, or I want to look like Angelina Jolie, or I want to look like Brad Pitt. So you need to make sure that you set their expectation right. You are aesthetic doctors, you are not magician, okay? Now, dealing with dissatisfaction, you need to have a strategy on how to deal with patient dissatisfaction. Okay, so now I move on to skills and qualifications. So what are the different types of training provider? Now, before I said that, right, because one of the common questions that I get from medical professional is that if I get myself trained in aesthetics procedures and I have the certificate, does it mean that I'm able to say if you're from India and you want to come to Europe and start working in Europe as aesthetic doctors. And the question will be, is that enough for me to become an aesthetic doctor in that country? The answer is no. You still need to convert your medical license into the working license, whichever country that you want to work in. And once you convert those license, your medical license, and you are allowed to work in, say, for example, in Ireland, then you are able, with the training qualification, the additional training qualification in aesthetic industry, then you will be able to work in any aesthetic clinics. Okay, so that part of converting your medical license still stays. You still have to convert your medical license first, then you can start practicing your aesthetics. So the different types of training provider, as I said, is professional training institution that only focus on medical aesthetic procedures and design only for medical professionals, that is providing an end-to-end support. Or there's a second type of provider, is that there are current doctors that give training, preceptorship or fellowship as a side income, because obviously they must be not so busy, so that's why they are able to give training. And the other type is the product and device company. So these are very specific. So say, for example, if you want to do fillers injections right now, so say, for example, the Elegant, if you want to start using Elegant, the product company need to train you first so that you understand how to use the different type of fillers before you can start injecting, before they sell to you. So this is actually a must, but this is called product company. So product training, in my terms, are not a professional training, because they are deal with just the product itself, all right? Because they are not really training you to become a aesthetic doctors. So training school plus clinic provider, usually owned by nurse, practitioner, or aesthetic doctors, to give training to anyone that is interested. So there is no control, so they will train anyone. And usually this type of a training school, they go by volume, because they want to train as many people as possible. So therefore, if you talk about the standards wise, in terms of all the three of number 2, number 3, and number 4, number 2, there is a serious conflict of interest, because a lot of times the doctors that is providing the training, aside from the business, they will train, for example, in the US, because if you don't have the US license, you cannot train international doctors. So therefore, you have to train your local doctors. And what happened is that means that you are creating your own competitors. So a lot of times the trainer tend to keep certain secrets just so that they can be the best. So that's why I said that there is a conflict of interest. And for product training, you got very biased, because what you learn is only product and devices. And for example, the training school, as I said, they go by volume. So therefore, you as a doctor will be training with non-medical professionals. So usually the standards will be, so different. So that's why in order for them to cater for all kinds of level, so therefore they have to, certain information, their quality will have to be compromised. All right. So for eCamps, let me tell you a little bit more about why eCamps is so different, and why a lot of the doctors is actually trained by eCamps. Is that, firstly, we are established since 2008. Until date, we have more than 35 faculties, experts that is in the particular fields that is training for us. And we have 8 departments. So 8 departments, meaning we have breast surgery department. So each department is specialized in that particular area. So we have breast surgery, we have face surgery, we have hair transplantation, we have all the non-surgical, which is the aesthetic medicine department. We have body contouring department, we have genital department, we have regenerative medicines department, and we have aesthetic business department. So all these 8 departments are specialized, and they are headed by the experts in this field, together with all the other experts to deliver the course and to set out the programs, because each department will have a lot of different level 1, level 2, you know, the beginning level, and then all the way to the expert level of training of different modules. And to date, we have 14 training locations worldwide. We have, among all our faculties, we have more than 300 scientific papers being published, and more than 20 books that is being published, especially just on aesthetics procedures. And of course, we have right now certified more than 1,800 doctors worldwide. So in terms of what we provide 6 different types of fellowship, from short fellowship to 3 months fellowship. And we have online courses, 68 online different courses. We have 23 hands-on courses. We also arrange private training for any medical professionals. We also give business consulting just to make sure that the doctors are actually able to survive in this competitive world. And of course, we provide star-rated clinics just so that for the patient to be able to know which clinics is worthwhile for them to visit. So typically, this is our module, how it looks like. So we provide the didactic lecture first, then we move on to cadaveric dissections, teaching the doctors the anatomies, and this is also injectables. We do the same thing. We want to make sure that the doctors understand where they are injecting, which is the safe zone, which is the danger zone, where to avoid. And then they also need to learn how to treat complication, because without teaching you complication, it can be a very devastating outcome. And this is the reason why up to date we strongly don't train nurse. And that's because, for example, in the country like in US and UK and in Ireland, in order, if there's a complication in fillers especially, you have 45 minutes when there's a vascular compromised. You have 45 minutes to save the patient before it goes blind. But a nurse in Ireland are not allowed to be injecting hyalase. So what happened is that in order for the country complication, basically when they have an issue, they need a medical doctors to actually dissolve it. Of course, right now, as I said, the regulation is so loose. A lot of the injectables nurses, they do have hyalase that is actually sitting on the shelf to treat the complication. But sometimes the complication could be, in order to save the eyes, you need to do retrobulbar injection, which is behind the ear. Those people that is from ophthalmologist, you will understand what I'm talking about. And these are not, even a plastic surgeon has never been taught how to handle that. So that's the reason why it is so important. And that's why until right now, we stick to the fact that anybody that come to our course, they have to come to a complication course, because they need to understand and to know how to treat, how to save the patient before it can be very devastating outcome. So that's why we have cadaveric dissections. And for any surgical procedures, it is a must that all the doctors, even if they are plastic surgeon, they must come to the cadaveric dissection course first, hands-on course first, before they can touch the patient on our live models. Because on our live models, for example, we are doing facelift, we're doing liposuctions. It's one patient, one side is performed by the faculty and the other side is performed by the surgeon. So therefore, if the trainee are not well prepared, they are not allowed to touch the live models. And again, these are all elective procedures. So all our didactic lecture, there is a theory exam, and of course, there is also a practical exam when they are doing the hands-on part. And we will then issue them when they pass the exam, they will get their worldwide recognition certifications from us. And the after support is also very important, because we don't believe that once we teach them, they come for a 2 days course or 3 days course or a week course, and that's it, they are able to be alone. No, because a lot of times you have different types of patients, different challenges. So this is where we allow the alumni to come back to us and ask our faculty questions, just so that we are able to help them, and give us our opinion. How should they approach this patient? How should we avoid? Should we do it? Should we not do it? So all this we actually discuss with our doctors that is actually after they have certified with us. So we continue to support them. And how you can then integrate into your practice is that, be it whether you are a private dentist right now or a GP practitioner, or you could be an ophthalmologist or plastic surgeon, when you want to, or you could be an anesthesiologist, when you want to start your training in aesthetics, you need to, when you want to start when you want to start a practice, you need to, the first protocol is always get your training and understand, based on your specialty, what you can do. For example, I would not expect an anesthesiologist to actually start doing surgical procedures, because you do need to have a certain background. You need to have a surgical background before you can actually start doing that. So therefore you need to then sit down and understand, okay, what should I start providing? What kind of procedures I want to start providing? Because different procedures, your clinic's design layout will be different, and the product or devices that you need to buy is also very different. So you need to start purchasing all the products. What are the devices that you need? What are the things you need? Then you need to prepare your facilities, whether a treatment room or operating room, or how many consultation room do you need, or a laser room. So all this you need to take into consideration. Then you need to gather the right team, whether can you retrain your existing team so that they understand what is aesthetics procedures. And then you need to design a new workflow for all these new procedures. Get all your legal regulations, consent form, pre-operation, post-operation ready. Then you need to start marketing, and then you can launch your procedures. Okay. And from the financial aspects, you need to look into your cost, your pricing strategies, and also your potential revenue. So the cost structures is very different from a non-surgical clinic to a minimally invasive clinic, things that is done under light sedation or local anesthetics, and surgical procedures, or spa or wellness or skin clinics. All these, the setting and the layout can vary a lot. So for example, a non-surgical clinics, it depends on how much design you want to incorporate that in. It can cost between 350K in Ireland all the way to 2 million just to build a practice up. And of course, you need to then consider, the cost that is input there. Mostly high cost, high value is manpower resources. They're expensive. The devices are expensive. Marketing and PR is an ongoing thing, and they are expensive. And without marketing, you can't do anything. And malpractice insurance is also a very important aspect. Again, depends on the country. Certain country, they don't have malpractice insurance. But for those countries that have malpractice insurance, this is the first step you need to find, because their premium could be very, very high. And of course, the clinic management software, you need to take into consideration where you're going to store the data, how you're going to store the treatment record, how you're going to store the consent form. Are you going to do it hard copy, which is the ancient way, or are you going to have a software system to help you manage your clinics? So all this you have to take, all these are cost. Then you need to look into your pricing strategies, how to design your pricing strategies, look into your competitors, how much they are charging, and look into how cheap they are charging. Then maybe you can do the average, And the best thing is actually to find your niche procedure, what you are good at, and find a niche procedures and try to avoid price war, because right now it's so saturated. So therefore everybody is providing aesthetic procedures. So you need to make sure that you find your unique selling point so that you can avoid price war, and make sure you package your details, have a packages procedures, like for example 3 procedures, 2 procedures, and try to have a retained customer strategy, how to retain, how to have your patient keep coming back, how to make sure that you grow old, you age with your patients. Then you can look at your revenue potential. Which are the prices, which are the procedures that brings you more revenue, which are the procedures that brings you less revenue, but brings you a lot of quantity that people foothold to where people comes into your clinic. So all this you need to take into consideration, all right? So marketing and building a patient base, of course, you need to then think of what is the brand, understand your market, know who is your competitors, find your unique selling point, and then find the brand that you want to call that company or the clinic. Do you want to use your own name, or do you want to use a generic name, or a name that is something to do with, you know, like a Venus Medical Clinic or a Numi Clinic, you know? So a generic, a lot of them, they are actually using their last name. So if you do that, you need to take into consideration whether how big you want to grow, because a lot of times the bigger you grow, if you tie down to your name, that means that a lot of it's difficult for you to hire people or spread your responsibility to hire more people, because most of the doctors, they do not want to work under another doctor's name if they are equally, you know, able to, their skill sets is equally in par with you. So all this you have to take into consideration before you jump in. Digital marketing, you need to prepare. You need to have your website ready. You need to make sure that it is highly SEO optimized. Social media marketing, Instagram, TikTok, LinkedIn, all this is a must. And of course, try to bring in your AI powered, just so that you can actually market more better. And then patient retention, you need to look into how to handle complaints. Be prepared for it, because you always have to make sure that whatever that you do, patient will come back and complain. So your first protocol is to have a strategy to handle patient complaint, because they can drive you crazy and they can drive your business down. So there is a statistics that say that every one unhappy patient, you are losing 50 clients, potential clients. So that's why it is very important that you need to handle your patient complaint strategy. Focus on patient experience from the moment they pick up the phone, call you, and that first experience with your receptionist, all the way to when they have their procedures. All these have to be tightly, the flow has to be so tight, and make sure they are experiencing, because now you are talking about elective procedure. Elective procedure means they are healthy, they come here, they give you the money, they expect service. So you are more like a service provider rather than a medical practitioner, all right? So your post-treatment care is very important, and of course, create loyalty program just so that you can retain your patient. As I say, it is very important to create a business that grow old with your patient. So with this question and answering session, so I didn't really take a look at the chat here, so maybe I'm just gonna USA, the venture, USA sometimes circulate in cosmetics. Okay, so can I say that at Pyn Lim, you are from USA and you want to venture into it, but what kind of a are you a nurse or are you a doctor? Pre-operative nurse practitioner. You are from Nigeria. I think in Nigeria, that for nurse practitioner, I think you can do aesthetic medicine, all the non-surgical procedures, if I'm not wrong.
Hello.
Yes. Hi.
Hello.
Hi. Can you hear me?
Hi.
Hi.
Thank you for your good presentation.
No problem.
For me, it's good to hear because I'm a plastic nurse. But I have the problem. Why not the many nurse still not knowing about plastic surgery?
Why? Sorry. Why? Many of you?
Why many countries we focus on the doctors, residents, specialists, but on part of the nurses who work in scrub nurse or who work in post-op is still no knowledge about plastic surgery, only arrangement.
Yeah. So let's say, for example, in a environment, for example, when we do the training on surgical training, for example, if we do a facelift or an eyelid surgery, very often we encourage the physician to bring their scrub nurse with them wherever there is scrubbing in, just so that they can actually see how is the procedure while they are learning, while their surgeon is learning, so that they know how to get ready. So this is how the training at this moment. There is no specific training only for the scrub nurse or for the anesthesiologist. In fact, actually for eCamps, end of this year, we wanted to launch a course for anesthesiologists on how they do the sedation, because it is a very different knowledge and different way when you work in a hospital environment, because when you are working in an aesthetic clinics where they are doing surgical procedures, they are doing very kind of a deep sedations depending on, again, on the surgery. So this is something that the anesthesiologist should know. And of course, for scrub nurse, a lot of the time, like for example in Italy, I know that the scrub nurse usually, in order to speed up for the plastic surgeon, they need to
even cycling nurse.
Sorry.
Even why not focus on cycling nurse, because plastic surgery have many materials which is not familiar with us.
Okay. So therefore, you mean that there should be a training for the scrub nurse to then understand what are all the different instruments that is required, right?
Yeah.
Yeah. So yes, this is actually one of the things that a lot of times after when we do the training, because during our training to the doctors, we in fact actually train the doctors about all the different instruments that they need, in the hope that they will actually go back and they will train their nurses. So that's the reason why I say that, a lot of times we encourage the doctors to say that you should bring your scrub nurse or your assistant with you, just so that they know how to prepare the theater for you. And like, for example, in our training, our fellowship program, what we have is actually a part of the training is that our faculty will actually go to the delegates clinic, the doctor's clinic, and then we get them ready, prepare their clinics ready together with the scrub nurse, just so that we can help them perform their first procedures together with them, in order for them to get ready, in order for their team to be ready. So all these are actually very, very important. You know, the whole team need to be prepared.
Okay.
And for example, like our hair transplantation, we provide training to hair technician too, just so that again, but the hair technician has to come with their medical doctors, just so that the whole team can train together to be ready.
Okay, thank you for a good answer.
And someone said, this is Nurse Alexis from Rwanda. I'm asking about nursing specialties can apply for aesthetic surgery nurse. At this moment, yes, nurse, as long as you are a registered nurse, and if you want to venture into aesthetic surgery, if you can find a clinic, in fact, actually, a lot of clinic will be willing and happy to actually train,
I
take
think
you on board.
in Rwanda we have Operation Smile who locate in our country, but not every hospital.
Sorry. Sorry,
Sorry?
I don't understand. So in Rwanda, you
in our country, in Rwanda, we have a partnership with Operation Smile.
and they
Work with our country in plastic surgery. Like in this week, we have surgery in a part of hospital of Rwanda. But there is still a problem of about nurses. When we prepare outreach for operation, still the problem of knowledge about nurses. But I think you will be better.
So sorry, I can't really understand. So basically,
I think my network is not good.
So I think
I'm told that for example, in this week, we have outreach of plastic surgery.
Okay.
In our country.
Okay.
By partnership with Operation Smile, you know?
Yeah.
Operation Smile.
Operation Smile, okay. And yeah, so
yeah, in this week we have surgeries, plastic surgery.
Correct.
But we have still problem about nurses, especially in circulating area.
Yeah. So
because our knowledge about plastic surgery is still low.
Yeah.
But I think it will be better after your good information.
No, I totally agree with you. At this moment, there is no training for to train a scrub nurse to be ready for aesthetic surgical procedures, because again, these are all so different and so specific to depending on the clinics that you will be working, because it's all private. So therefore, you know, different clinic has a different standards. As I said, you know, a lot of times you have to, at this moment, is that you need to be able to work with a aesthetic clinic first, aesthetic surgical clinic first, and then you will be able to come for the training together with your surgeon, just so that both of you can learn together on that particular procedures. All right. So at this moment, this is the case, because there is no standalone training just for a scrub nurse to learn about aesthetic procedures, so that they can support the aesthetic surgeon. Okay. So now the next thing is, how do you rate body jet and in liposuctions and for fat harvesting procedures by Jean? So how do I rate them? To be honest, I have a mixed feeling and mixed feedback. Personally, in our clinic, in my clinic, I have used it before. I am not as impressed compared to the ultrasound assisted liposuction. And the reason is because I think it depends on whether what type of patient you have. Because if you have bulk patient, big patient, you are not really doing any form of a definitions. You are just debulking. I think body jet and also the traditional power assisted liposuction, I think it is quick and it is fast to actually debulk. But if you really want to do a definitions on the body procedures on liposuctions, the ultrasound by far it is still the best. And of course, then you talk about the fat that you are harvested, whether how much it is, how sustainability, whether how much will survive. For the ultrasound, if you turn down the energy, the fat survival rate is actually as good as the usual traditional power assisted fat. So and plus you can do definition. So therefore, at the end of the day, I think it depends on your market share.
Thank you.
So it depends on your market share, whether what kind of a customers that walk in to your doorsteps, and what kind of a clinic you want to have. Whether do you want to do more definitions, or do you want to do just debulking, and do you want to do circumferential tie, the areas that you are doing. So body jet, when it comes to circumferential tie, they are actually not as good and predictable, the results, compared to ultrasound. In the UK, along the same pathway, surgical first assistant, sorry, Tai, I don't really understand your question. In the UK, this along the same pathway for SFA?
Oh, sorry, Pym. So what I was trying to say, based on the question that I believe Oda Ituze, what she was saying and asking about nurses not having enough training to be able to do plastic surgery or have the exposure to do plastic surgery in Uganda. So I was referring to that and saying what nurses in the UK or practitioners in the UK, what they do is go along the pathway of training as a surgical first assistant in order to get that exposure to be able to do, not to do, but to kind of like assist with plastic surgery or plastic aesthetics. And that kind of like gives them a better exposure and knowledge in that area. That's what I was referring to with that comment.
I think, again, it depends on the kind of technology specialist. What is a surgical technology specialist?
This is the surgical technologist, first instrument we handle and the surgeries procedures.
But are you a medical surgeon?
Surgical technologist, surgical assistant, first assistant, then second assistant, and handle instrument, surgical technologist.
Okay. Well, depends on the country. For example, in Ireland,
this is a 4 years degree.
Huh?
Pakistan, ma'am.
Pakistan.
Pakistan.
I don't think Pakistan has any regulation about that. I don't think they are that specific to say whether are you able to do or you are not able to do. But I believe, I also know that in Pakistan there are surgical assistants that is actually performing liposuction together with the the plastic surgeon or the cosmetic surgeon to assist them.
Yes, ma'am.
Because
This is
sometimes
a
liposuction could be a big procedures, so therefore they need two person to speed up the procedures in order for them to do it quicker. So sometimes, yes, in that aspect they have, but they still have to be working under somebody, a surgeon, a medical surgeon first.
yes,
Same for in
yes, ma'am.
Ireland. Sorry.
Yes, ma'am. This is a 4-year degree program. We study in university in 4 years, 8 semesters.
Yeah.
We study anatomy, biochemistry, pharmacology, all subjects of medicals. And when I go hospital, we assess the surgery with the surgeon, handle the instruments.
Yeah. So you will still then do the same role as in you are assisting
Thank
a
you, ma'am.
medical surgeon. Okay. I think, have I answered everything? Oh, complaint policy, Angelique. Oh, hi, Angelique. How are you? Tell you more about the complaint policy that I recommend. I actually have another procedures to handle all the complaint policy. I will give you that. I will give you that presentation, Angelique, just so that then you can have that. Just so it's going to be very detailed. I don't want to bore the rest of them. So, and who else? I think I have answered everybody.
Thanks so much, Pyn. That was a wonderful presentation. I think I just have a question, if you don't mind. I know time is far spent. You spoke more in relation to, let me say, the business aspects of it now, because basically all of us, we all need to be financially independent. And that's the reason why we're doing this, because there's a lot going on right now in the contemporary society. Everyone wants to stand alone. They want to have their clinics. As you mentioned, in a country like Nigeria, for example, the perioperative nurses, they have the license would authorize you to have your own clinics. Even you would see some peri-op nurses, especially the males, they have their own clinics, they do surgeries and stuff, but it all depends on the license as well. As you mentioned, it needs to be regulated. So do you mind letting us know, like, the salary prospects in this? Like, if you set up the clinic, I mean, what do you stand to gain? I know, like you mentioned, cadaveric dissections and stuff, and it's going to be expensive having to fly that over for the training and stuff. So like after going out through the training, what can a person or a professional, a medical professional, what do they intend to gain from that?
Okay. So say for example, our training, when you talk about you have your own clinics, you're talking about non-surgical clinics, right? For nurses. At the end of the day, they wanted to gain financial independence.
Yeah.
So the procedure that they can do is actually the non-surgical procedures.
Yeah.
So for the non-surgical procedures, for the investment cost on a proper courses in order to be certified is between 4,900 with the cadaveric dissection and the live models, and for one modules. So per modules it varies. So this is and there is, you could have two from 1 to 5 different modules that you need to complete in order to get a proper training. So per course is we're talking about the figure around 4,500, 4,900. So and in terms of the return of investment, I'm not sure in Nigeria how much is I know that the injectables for fillers, the product cost itself is actually quite expensive in South Africa. In fact, actually, I was actually trying to help one of our surgeons to buy a liposuction machine. The cost was almost 1/3 higher than what you get in Ireland or in Europe. I don't know why. Maybe it's because of the regulation, or is it because of the markup? But it is 1/3 higher. So in the end, what we did is we tried to source for if they can buy outside and then they bring it in themselves. So anyway, so for fillers, I believe that it is also quite high in Nigeria. So say for example, a full face injections in Ireland, we charge between 2,000 to 2,900 for injectables just for one patient. So we're talking about the return of investment is around 2 patients in order for them to then continue on, to charge and to earn. So this is the kind of a aspect. The revenue for a non-surgical clinic, they can go as high as $1 million all the way to 5 million or even 10 million, depends on the number of clinics you have.
Thank you so much. It's a great eye-opening session. I think we need
I hope I answer all the questions.
Yeah, you tried. We need to look more into that. So you spoke extensively in relation to key considerations, training concepts, ethical approaches. I know a lot is going on as well. Like as you mentioned, training is needed. If there is training and there's not going to be like court cases in relation to plastics and more, it's going to be reduced. And you spoke about the legal considerations, especially you emphasize that all you see is women. I mean, women do all these procedures more. They want to be beautiful. They want to get on with the trend and everything. And people need to actually be ethical in what they do as well. So we really want to say thank you for honoring our invitation. Thank you so much for sharing your knowledge. Did we mention, did we mention the discounts for TORG members? Like if we want to join your training and the countries that you run the trainings, would that be in Ireland or, sorry now to bring you back, just
the training is actually in the in Italy, and right now we have expanded to be in Malaysia too. So there is 2 training, and certain training is actually in Greece, depending on what type of training, like tummy tuck and regenerative injectables is in Greece. And then our breast surgery is actually in Vienna in Austria. So, but most of the surgery is actually, most of the other courses is actually based in Milan and Verona.
Okay, thank you so much.
And for the and for the discount, we did. I can't really remember what is it, but it depends on the courses by courses. So we have all the different different grade and different discount. So do reach out for us so that we can actually apply for the discount for you. Yeah, once you tell us that you are from TORG Webinar, we will be able to apply the different discount for the different courses that you are that you will be coming in to actually learn. As I said, I'm trying very hard right now, because more and more, a lot of the scrub nurse actually wanted to learn about such procedures as an assistance in the practice. I think I have a lot of demand on that, so we might actually, teach anesthesiologists and scrub nurse on how to assist the plastic or the aesthetic surgeons.
Okay, thanks.
So that they can work.
Pyn. And just one more thing. I know you mentioned the complaints policy. I know it might be applicable to another category in TORG because we have surgeons, first assistants, and more. So do you mind, can we get this presentation and the complaints policy as well, if you don't mind? I mean,
no problem. Actually, for the complaint policies, for me, I tilt towards very much as a aesthetic private practice. I mean, if you want, I can actually do a short presentation on the next webinar if you want. Then we can talk about that, so that I can or else what I can do is that I can actually open up that the complaint policy. I hope it actually makes sense to you guys. I can give you guys the slides.
Okay, thank you so much. Thanks a million. Thanks for honoring our invitation.
No problem.
Thanks to all the team, I mean, the Education and Training Committee for facilitating the session. And I really want to say thank you to everyone who connected from all over the world, depending on your time zones. Good morning, good evening, good afternoon, and thanks a million. I think our next webinar will be in another 2 weeks. And we would be going to ophthalmology, something related to glaucoma, open angle and closed angle, so that we can raise awareness about that as well. So thank you everyone for joining. Thank you for connecting. Thank you, Pyn.
So these are my contact details here
Okay.
on the slide you can see. So yeah, do feel free to contact me directly.
Thanks, Amelia. We'll be waiting on the presentation and the policy.
All right,
Thanks.
cool. Thank
Bye.
you.
Bye, everyone.
Bye.
Bye.